Vaginal itching, burning, and irritation are symptoms that many people experience at some point in their lives, yet they're often overlooked, dismissed, or misunderstood. While it's easy to brush off these sensations as minor annoyances or assume they'll resolve on their own, these symptoms can be indicators of underlying conditions that deserve attention and care. Understanding the causes, recognizing the warning signs, and knowing when to seek help are all crucial steps in maintaining your vaginal health. The vagina is a delicate and dynamic part of the body, designed to keep itself clean and balanced through a precise ecosystem of beneficial bacteria and natural secretions. However, this balance can be disrupted by a variety of factors, some harmless, others more serious. When itching, burning, or irritation occur, your body is sending you a message. It's important to listen. One of the most common causes of vaginal discomfort is a yeast infection. The yeast Candida albicans lives naturally in the vagina, but when its growth gets out of control, it creates an environment ripe for infection. Yeast infections can cause intense itching, a burning sensation, and thick, white discharge that resembles cottage cheese. While they're usually not dangerous, yeast infections can be extremely uncomfortable and, if left untreated, may recur frequently. Bacterial vaginosis is another frequent culprit behind vaginal irritation. This condition occurs when the natural balance of bacteria in the vagina shifts, allowing harmful bacteria to proliferate. The result can be itching, burning, and a thin grayish discharge with a distinct, fishy odor. Unlike yeast infections, bacterial vaginosis often produces less severe itching, but the burning and irritation can still be very noticeable. Sexually transmitted infections, STIs, are a significant concern whenever new or unusual vaginal symptoms arise. Infections like chlamydia, gonorrhea, trichomoniasis, genital herpes, and human papillomavirus, HPV, can all cause discomfort, often accompanied by other symptoms such as unusual discharge, sores, or pain during urination or sex. These infections can have long-term consequences if left untreated, including fertility problems and increased risk of other infections. Prompt diagnosis and treatment are essential. Irritation can also result from non-infectious causes. Allergic reactions to soaps, detergents, fabric softeners, scented toilet paper, or personal hygiene products are common sources of vaginal discomfort. The skin and mucous membranes in the genital area are especially sensitive to fragrances and chemicals, which can trigger redness, swelling, and itching. Tight clothing made from synthetic materials can trap moisture and heat, creating conditions that promote irritation. Hormonal changes, especially those related to menopause, pregnancy, or breastfeeding, can also lead to vaginal dryness, thinning of the vaginal walls, and increased sensitivity. This can make the area more prone to itching, burning, and even small tears. For some, these changes are temporary, but for others, they require long-term management. Dermatological conditions such as eczema, lichen sclerosus, or lichen planus may also present with persistent vaginal itching and burning. These conditions can cause white patches, red areas, or thickened skin, often accompanied by intense discomfort. Although rare, they can sometimes lead to more serious complications if not managed appropriately. It's important to pay attention to the context and patterns of your symptoms. Did the itching begin after starting a new soap or laundry detergent? Does it worsen after sexual intercourse? Or is it accompanied by unusual discharge or sores? Are you experiencing other symptoms like fever, abdominal pain, or pain during urination? These details can help you and your healthcare provider identify the underlying cause and guide appropriate treatment. While mild symptoms may sometimes resolve on their own, there are several situations where you should seek medical attention right away. If you develop sores, blisters, or warts in the genital area, experience pain or burning during urination, notice a foul-smelling or unusual discharge, or have unexplained bleeding, it's time to consult a healthcare professional. If symptoms persist for more than a few days, worsen, or recur frequently, don't ignore them. Persistent irritation can sometimes signal a chronic condition, or even, in rare instances, an early sign of cancer. Preventing vaginal irritation starts with good hygiene, but it's important not to overdo it. The vagina is self-cleaning and does not require douching or the use of harsh soaps. Instead, gently wash the external genital area with warm water and a mild, fragrance-free cleanser. Avoid scented products, bubble baths, and sprays, all of which can upset the natural balance and cause irritation. Wearing loose-fitting, breathable cotton underwear helps keep the area dry and reduces the risk of irritation. Change out of sweaty clothes promptly after exercising, and avoid sitting in wet swimsuits for extended periods. When wiping after using the toilet, always wipe from front to back to prevent introducing bacteria from the anus into the vagina. During menstruation, change pads and tampons regularly, and opt for unscented products whenever possible. If you use condoms or lubricants during sex, choose those that are free of dyes and fragrances, and consider hypoallergenic options if you have sensitive skin. For those experiencing dryness due to hormonal changes, over-the-counter lubricants and vaginal moisturizers can provide relief. If these are not sufficient, talk to your healthcare provider about prescription options or other therapies. If you have a history of recurrent infections or chronic irritation, your healthcare provider may recommend additional testing to rule out underlying medical conditions. This may include cultures or swabs to check for infections, blood tests to look for hormonal imbalances or autoimmune diseases, or even a biopsy in rare cases to evaluate persistent skin changes. Remember, vaginal health is an essential part of your overall well-being. It's not something to be embarrassed about or to keep to yourself. Open communication with your healthcare provider can help you find answers, relief, and peace of mind. It's also important to recognize that everyone's body is different. What may be normal for one person could be a sign of a problem for another. Trust your instincts. If something feels off, don't hesitate to seek help. Early intervention can prevent minor irritations from becoming major health issues. In addition to medical treatment, self-care plays a vital role in managing and preventing vaginal discomfort. Staying hydrated, eating a balanced diet, and supporting your immune system all contribute to your body's ability to maintain a healthy vaginal environment. Probiotics, found in yogurt and some supplements, may also promote a healthy balance of bacteria. Although the evidence is still evolving, stress can impact every part of your body, including your vaginal health. High levels of stress may disrupt hormonal balance, weaken the immune system, and make you more susceptible to infections and irritation. Taking time for relaxation, exercise, and self-care isn't just good for your mind, it benefits your body too. If you're sexually active, regular checkups and open communication with your partners are important steps in preventing and detecting sexually transmitted infections. Use protection, get tested regularly, and encourage your partners to do the same. For parents and caregivers, it's important to teach children and adolescents about proper genital hygiene and the importance of seeking help if they experience discomfort. Early education fosters a lifetime of healthy habits and reduces the stigma that often surrounds these topics. Ultimately, vaginal itching, burning, and irritation are symptoms that should not be ignored. They are your body's way of telling you that something needs attention. Whether the cause is a simple irritation or a more serious infection, prompt recognition and appropriate care can make all the difference in your comfort and long-term health. Don't suffer in silence or wait for symptoms to go away on their own. If you experience persistent or severe vaginal discomfort, reach out to a healthcare professional you trust. With the right knowledge, support, and care, you can protect your health, find relief, and feel confident in your body once again.